In this video, we will discuss about triad in surgery. The first triad we have mycetoma, multiple sinuses, cerebral discharge, and painless subcutaneous mass. Next is trauma or death. We have triad for trauma or death, which is acidosis, hypothermia, and coagulopathy. Next, we have Cushing triad for raised ICP, hypertension, irregular respirations, and bradycardia. We have Beck's triad for cardiac tamponade, which is hypotension, muffled heart sound, distended neck veins. We have triad for brain tumor, it is raised ICP, focal deficit, or seizures. We have triad for minor stages, which is tinnitus, intermittent vertigo, and unilateral fluctuant sensorineural hearing loss. We have tried for Zollinger Ellison syndrome, which is increase in gastrin level, increased acid output, non-beta cell tumor. We have tried for ruptured aortic artery aneurysm, severe abdominal pain, pulsatile abdominal mass, and hypotension. We have tried for Mackler's triad, Borhap syndrome, vomiting, retching type of vomiting, subcutaneous emphysema, and chest pain. We have choledochal cyst, which consists of the right upper quadrant pain, jaundice, and palpable abdominal mass. We have Rickler's triad for small bowel obstruction, ectopic gallstone, and pneumobilia. We have tried for Curarino triad, which consists of sacral malformations, presacral mass, dermocyst, teratoma, or anterior meningeocele, anorectal malformations like stenosis. We have Carnage syndrome, which consists of the gastric cyst, pulmonary chondroma, and paraganglioma. We have Bart's triad, which consists of upper abdominal pain, inability to insert the Ryle's tube, and retching. We have the Ohasi triad, which consists of the related hepatopancreatic duct, fish mouth appearance, and mucin-form ampullary opening. We have tried for renal tumor, which consists of the loin pain, intermittent hematuria, palpable loin mass. We have Leng's triad, which consists of the loin pain, hypotension, and palpable loin mass. We have Saint's triad, which consists of hiatal hernia, colonic diverticulosis, and gallstone. We have Trotter's triad for nasopharyngeal carcinoma, which consists of the conductive hearing loss, trigeminal neuralgia, and immobile ipsilateral soft palate. We have Dulafield triad, which consists of the hypersensitive skin, McBurney's point tenderness, and reflex muscle contractions. We have TAO, consists of the triad of the occlusion of small or medium sized vessels, Raynaud's phenomenon, and superficial thrombophlebitis. We have Gilroy Baron's triad, which consists of the pain due to posture change, tenderness, and abdominal scar, pain in the abdominal scar. We have Schwarz abscess, which consists of the fever, flexion in the hip joint, flexion of the hip joint, and the loin pain. We have fat embolism, which consists of the respiratory failure, petechial hemorrhage, and the confusion. We have cyst, palpable, solitated mass, anemia, and the bleeding. We have Murphy's triad for acute appendicitis, which consists of the pain, fever, and the vomiting. First pain, second vomiting, then fever. We have Mikulic's syndrome, which consists of the enlargement of the salivary glands and parchment like dryness of the mouth and the narrow of the palpebral fissures. We have Pancoast triad, which consists of the excruciating pain in the arm, erosions of the ribs, and Horner syndrome. We have pyelonephrosis, which consists of the anemia, loin pain, and the fever. We have somatostatinoma, which consists of the diabetic mellitus, styria, and the cholecystolithiasis. We have ocular cardiac reflex, which is also known as the Toll's eye reflex, consists of the bradycardia, syncope, and the nausea. We have normal pressure hydrocephalus. We have magnetic gait. cognitive declines, and the urinary incontinence. We have Charcot's Triad, intermittent upper abdominal pain, upper quadrant pain, right upper quadrant pain, intermittent jaundice, and intermittent fevers. We have People's Triad, symptoms of induced by the fasting, symptoms relieved by the glucose administrations, hypoglycemia less than 50 milligram per deciliter. We have tried for echinacea cardia, dysphagia, weight loss, and the regurgitations. We have Bicos tried for hypocoagulal states, stasis, and endothelial injury. We have Quinkis tried for upper abdomen GI bleeding, pain, and jaundice. We have Tilox tried for soft fluctuating swelling in the umbilical regions, zone of the resonance all around, and freely mobile mass. Galesia tried Dupuytren's contracture, pioneer stages of the penis, and the retroperitoneal fibrosis. We have rupture of the bulbar urethra triad, perineal hematoma, distended bladder, and urethral hemorrhage. We have Sandblom's triad, melena, pain, and the jaundice. We have prune belly triad, cryptorchidism, genetic urinary defect, abdominal wall defect. We have chronic mesenteric ischemia, postprandial pain, weight loss, and the food fear. We have retroperitoneal fibrosis, which consists of the deviation of the middle third of the ureter medially, extrinsic urethral compressions, and hydrouretronephrosis. We have Van der Hoop's triad, which consists of the otosclerosis, blue sclera, and the osteogenic imperfecta. We have Hereford triad for sarcoidosis, which consists of the bilateral parotid enlargement, uveitis, and the facial nerve palsy. We have Gradingo's triad or Gradingo syndrome for petrositis, which consists of the diplopia, profuse discharge from the ear, and retroorbital pain. We have Melkelson-Rosenthal syndromes, which consist of the tongue fissuring, swelling of the lips, and recurrent alternative facial nerve palsy. Thank you.